So this is the anterior view of the heart, posterior view. If you open it up, we're going to use this half first. Your interventricular septum, interatrial septum, right ventricle, right here, left ventricle. Notice how the muscle is much thicker on the left ventricle than on the right. It's because we have to go up through the aortic valve out to the body. On this side, we have our right atrium, and I have the auricle pinned back here so that you can see your pectinate muscles. There and there. These are two leaves of your tricuspid valve. Papillary muscle. Chordae tendineae. More chordae tendineae. Papillary muscles. And then this is your bicuspid valve. On the left side, connecting your left ventricle with the left atrium. Now through here, we've got our pulmonary veins. So there's one opening, and then it branches. And then another opening for the pulmonary vein, and the branches are not intact here. And then over on this side, we have our superior vena cava. Emptying into the right atrium. So again, superior vena cava. And then if we flip that over, we've got our inferior vena cava. Right there, entering into the right atrium. And you're supposed to have a separate opening for your coronary sinus, just medial to the inferior vena cava. But on this sheet part, the coronary sinus actually joins the inferior vena cava before it reaches the right atrium. So if you follow the same opening for this inferior vena cava, you can see that the coronary sinus opening is right here as well. And then from the back here, again, here's our pulmonary veins going into the left atrium. Now, let's look at the other side. So again, this is anterior, posterior. On the right ventricle, the muscle wall is much thinner than on the left ventricle here. On the right ventricle, you can see part of the tricuspid valve again. Chordae tendineae, papillary muscle. And most of the right atrium was on the other half of the heart, but you can kind of see pectinate muscle up here in the right auricle. And then on the left atrium, we've got our bicuspid valve, separating it from the left ventricle. So our chordae tendineae, papillary muscle, and if we open it up, you can see the trabeculae carinae in there. There's some right here. It kind of looks similar to the pectinate that we saw in the auricles. This is trabeculae carinae. Now up here you can see our aorta, and if you follow it all the way down, it's coming through the left ventricle. So the valve up in there, I don't know if we can get it on camera, but the valve up in there would be our aortic semilunar valve. And then same thing, aortic semilunar valve from that angle, which you probably can't see. That's okay. And then this is our pulmonary trunk, which is connecting to the right ventricle. And the valve, and there is your pulmonary semilunar valve, and we definitely can't see that. Here's your left auricle. Look at it from this side. This is the anterior of the heart. Here's your left auricle. Here's the pulmonary trunk. Here's the aorta. Part of the right auricle here. And then over here, the posterior version. You can see our right auricle more. And then just a little bit of the left right there.